Okay, this is about the Dean Ornish new paper, just came out July 2024, about using diet and lifestyle to treat early mild cognitive impairment, very early dementia, you might call it. So a couple things about this study. So the basic point, what's the big point on the study? They did show that by eating a plant-based diet and a lot of intensive lifestyle modification, the patients showed some improvement. The control group did not improve. All right, so this is considered the first randomized controlled clinical trial of lifestyle and diet for treatment of mild cognitive impairment or early dementia due to Alzheimer's. So one thing too is the word Alzheimer's is kind of a joke. We're not going to get into all the nuance of the term Alzheimer's, but there's real debate about whether Alzheimer's even exists. However, you could say there's a bunch of people that were older and all had dementia without any obvious name for it. So when you don't have an obvious name for it, they just call it Alzheimer's. But that's sort of a mild point. There weren't that many patients. There's only about 51 patients, and half of them were put in the control group where they just continued with their standard behavior. And then there was the intensive treatment group. And it was a very intense treatment. They were treated for 20 weeks, 5 months. And they not only got this plant-based diet, they also had a lot of social support. They did meditation. They did yoga. They were walking at least half an hour a day. So a lot of intense effort was put in them. They also would have meetings with their clinical care person several times per week for an hour at a time. Their spouses were quite involved. So there is something called the Hawthorne effect. Just means that if you pay a lot of attention to something and spend a lot of time on it, you often show an improvement simply from all the attention. It's like if you put people on any diet, it could be the stupidest diet in the world, but just because of all the attention for a couple months, they'll often improve from that. So, okay, we'll get on to more of that. It's what it basically says is they showed some improvement in multiple areas of treated group, whereas the untreated group worsened in all 4 measures of cognitive function. And here's the diet. Oh, I kind of skipped a page. Let me go back to what I just skipped, because I had to get my own picture off of there. So let me get myself off of here. Let's see. Showed improvement. Oh, there's a lot of modifiable risk factors to mention. Hypertension, smoking, depression, type 2 diabetes, obesity, sedentary lifestyle, social isolation. And those relate to almost all the chronic disease. And Ornish is pretty good about making the point that a lot of these diseases are almost like manifestations of the same thing. You know, and I've joked plenty of times, you go to the zoo and the zookeeper knows what to feed the animal, but you go to a human doctor and they don't know what to feed humans. Okay, so the zookeeper knows more than the clinical medical people doctor does. Excessive stress, activating sympathetic nervous system, also makes people sick. Consuming saturated fat markedly increases the risk of dementia, about doubles it. More fruits and vegetables, dramatically lowers it. The typical thing internal medicine-based doctors will say is, what's good for the heart is good for the brain. You'll hear Ornish say that. You'll hear Neil Bernard say that. And it's true. It's true. And so if you optimize blood flow to the heart, you're also optimizing blood flow to the brain. That's all well and good. The brain's more fussy, though. It's more sensitive to a lot of these toxins. Okay, we're not going to get into that too much. The diet. Now, here's a diet, and I actually think the diet could be improved. This diet is good, but it could be better. So fruits, vegetables predominantly, whole grains, legumes, and then soy. So why does soy have to be in there? Soy is not a good food. Okay, seeds and nuts. That's relatively high fat. If I was trying to prevent dementia, I would get the fat lower. And you look at the total fat for this diet, it's in the ballpark of 14 to 18%, which is not bad, but it could be improved. You've got to remember, white rice is only 1% of calories from fat. The amount of protein, 16 to 18% protein, so that's a little high, not bad. But, think about like Walter Kempner. He had him down to about, 2% of calories from fat. He had him down to 4% of calories from protein, which is dramatically low, perhaps, too much maybe even, but Ornish had incredible results. All right, so they were only eating about 63 to 68% carbohydrates. So I think that's not as high in carbohydrates as I would like. McDougall would like them up around 90% of their calories from complex carbohydrates, or at least 80%. Okay, let's see what else. Exercise. They exercise quite a bit, at least 30 minutes a day of walking, but also strength training exercises and other stuff with an exercise physiologist. So these patients got a lot of personal attention, coaching on how to improve their sleep, all these support groups. So, if you're a patient, normally you get a demented patient in the family, they just assign one person to be the caretaker or hire a caretaker or send the poor person to a nursing home. And they're pretty neglected, okay? Nobody wants to deal with them. So for these patients, getting all this attention, that's probably a big change in their life. So part of it I would see is probably a Hawthorne effect. But still, this is a proof of concept study. He showed something can be done. It's not automatically irreversible and progressive decline. They had stress management teaching, etc. What were they taking? They were taking omega-3 fatty acid supplement from Nordic Natural. So that's a very commercial, big, company. Curcumin, comes from turmeric. I worry about that in real life being contaminated with lead chromate, powder lead chromate. That's lead, okay? Coenzyme Q, for the inner mitochondrial membrane, also from Nordic Naturals. Nordic Naturals also was partly funded the study, so of course they're going to want to make it look good and put a lot of money into it. They're going to sell a lot of product from this. Vitamin C, vitamin B12, magnesium, something called lion's mane, and probiotics. Okay, so I would just get my fiber from eating the plant foods. You get plenty of magnesium if you eat a lot of plant foods. You still need B12. Vitamin C, you usually get a lot from plant foods, but you can supplement it more. That's a whole big subject, vitamin C. Okay, so here's where some of the graphs. Basically, if the number goes up, dementia is getting worse. So the control group, the dementia got worse. In the treatment group, the numbers are going down for cognitive impairment. So their cognition was improving according to the different tests. And they did a pre and a post intervention test and to know where the patients were at. And they did tend to show a little bit of improvement. So the conclusion was, in summary, patients with mild cognitive impairment or early dementia due to Alzheimer's disease, comprehensive lifestyle and diet changes may improve cognition and function in several standard measures after 20 weeks. In comparison, patients in the randomized control group, just the one that was the control group, they didn't show any improvement. So it clearly shows that intensive lifestyle changes in diet can demonstrate improvement. So it's worthwhile to study this in greater detail. I would agree with all that. So anyways, so that's the point. So the bottom line is, do I think this is a great idea? I think it's a big step in the right direction. I would improve the diet more. You don't need all that fat. Omega-3s, they're immunosuppressant, they're obesogenic, they increase, insulin resistance, so they can predispose to increased risk of diabetes. I don't like the immunosuppression either. All those, concentrated calories. So there's things about it that are debatable. I think there's room for improvement, but it was certainly very encouraging that it showed improvement at all, because no one else is getting improvement in these patients. And I would think, most demented patients are diabetic or pre-diabetic and hypertensive. So optimizing those things will likely optimize how they do. And then there's the whole business of avoiding all omega-6 fats. And then there's my theory of supply and demand, what causes neurodegeneration, etc. So anyways, I hope that was helpful.